Okay, good morning, everyone, and welcome to today's webinar, which is co-organised by DEDEP.eu, so an EU project which looks at promoting and establishing synergies between projects around dissemination and exploitation activities, so projects within the Digital Europe programme, and also CoordinaTEF, which is a coordination support action, which supports the testing and experimentation facilities across the Digital Europe programme. So my name is Nick Ferguson, and I'm a Senior Manager at Trust IT Services. We're an SME based in Pisa in Italy, and I coordinate the DEDEP project. And this is the second in a series of webinars which we are conducting on different topics related in particular to topics within the Digital Europe programme and topics which the testing and experimentation facilities address. We had a previous webinar on the agri-food sector a couple of months ago, and today we're looking at the health sector, which is the sector which is being transformed digitally, as many other sectors are, through new technologies, artificial intelligence, robotics, which is really transforming different settings within the healthcare sector. A large part of this transformation is supported through the Digital Europe programme. We have, of course, data spaces set up, huge initiatives such as the EU Cancer Imaging Initiative, testing and experimentation facilities where technologies can be validated, and European digital innovation hubs, which provide a doorway and access to the many SMEs which support the whole of the European economy. And then also cybersecurity projects to make more security and more trust in European products. So with so many ideas, with so much innovation, there's a lot of activity in Europe, but ideas are often not the real challenge. It's more deployment, and this is what the Digital Europe programme addresses. So, and this is something which we'll talk about today in our webinar, finding the right way and the right support mechanisms to connect together these different parts of the Digital Europe programme to enable deployment across Europe of these different solutions, which are funded through the European Union. So in today's webinar, we have two sections actually staying in today's event. Firstly, we'll be having this public webinar, which you've all joined, and I'm very pleased to say we have over 160 people registered for the webinar, 51% of which are women as well, which is important. And we have a large number, over 30 projects registered for the event too. So the first half of the event will run publicly. Okay, we have a set of panelists and speakers who will be joining us for this part from different parts of the Digital Europe programme. And we'll also be hearing an introduction from the European Commission as well. We'll then jump to the interactive workshop. If you are a representative of an EU-funded project, then we really would like you to attend this. This is meant to be an interactive activity, and we want people to participate and contribute as much as they can here. And we have already projects from across the Digital Europe programme registered here. So we want to identify and build on some of the discussions in the first part of the event around collaboration and synergies, and really try to create more discussion around this for the different projects. And you can see a list of some of the projects which have signed up. Well, they signed up this morning. We've had more registrants as the morning has gone on. So if you don't see your logo here, that's fine. Please don't join that second half of the workshop. So just some housekeeping rules. We are recording, so we want to publish this webinar after we finish. All the presentations will be available, and if you have any questions, then please pop them in the Q&A, box, and the speakers will try to get back to you on them directly. Okay, so the first speaker, I'd like to welcome Jaakko Aarnio, who's a policy officer at DG Connect at the European Commission, and importantly, he leads is involved in the working group with the European Digital Innovation Hubs on health. So, Jaakko, over to you.
Yeah. Okay. Thank you. So. Yeah, I'm Jaakko Aarnio, as mentioned. So I'm from the unit AI Innovation and Policy Coordination, and which covers all sectors. And I'm actually in the corner of the healthcare corner of that unit, and we are addressing digital health and supporting and the support for the SMEs. And we have the working group on digital health there. And in addition, we are also administrating from the Commission side the testing and experimentation facilities, and they are improving to improve product maturity and foster certification. And Petra will talk about that later. So we have approximately 40 European digital innovation hubs that are in this working group, and this includes training. And their job includes training, access to financing, networking, and testing. And so they're acting as kind of knowledge brokers or business brokers that nurture and bridge ecosystem actors and foster also the adoption of AI. And then already mentioned, I mean, this dissemination and exploitation for Digital Europe CSA, Coordinated Support Action, is organizing this event. We're bridging various other activities. So that's the roughly the case. And then concerning the SMEs that our unit is representing from the industrial perspective, the priority is actually receiving knowledge business brokerage services quickly. So they are not concerned with where that support originates. So and that therefore actually there's kind of natural need to bridge the funded approaches, but how to do that's another trick that we try to address here meaningfully. So the purpose fit bridges between ecosystem actors, both funded and commercial operators, would therefore be highly valuable from a deployment perspective. So it's not we do not want to actually to overwhelm the project coordinators. They do their job, and the bridging activities could also extend to their own hierarchies and CEOs, CTOs, and whatever we try here must be attractive enough. So we need to really to listen to what the project coordinators are thinking, what the organizations could be thinking, and how we can support them as a whole, not only the project themselves. So this session will include an open webinar, as mentioned, on practical pathways, and as I mentioned actually already, so we try to identify maybe a rationale beyond the current boundaries, addressing the clinical practice and the economic interest as well. So we will see this is the big challenge. So we have some examples of promising developments that are taking shape in funded and business acceleration services to strengthen AI uptake in health. And then we have, for example, collaboration between TEF Health and EDIH actors in Sweden and Portugal. So they bridge demand and supply side interests, and we would also welcome seeing this type of effort scaled across Europe for creating actually attractive environments for the potential uptake. And also there's some developments between the actors of EUKAIMA and this Cancer Imaging Initiative and TEF Health, and we would like to hear more about that. And also, if I didn't yet explain, so there's my colleague Alexandra Veselovska, a team leader from the unit A6, is representing actually the AI health in this webinar. So she's invited And then they are actually the pen holders of AI health in DigiConnect. Our unit where I'm from, we are just a little brother and sisters there, but we try to do our best to help the SMEs. All right, so I welcome the speakers and the panelists to participate.
Thank you very much, Jaakko. That's perfect. So with that, very important message around going beyond grant boundaries and collaboration between the testing experimentation facilities and the digital innovation hubs. I'll go into our first speaker, which is Petra Rita. So Petra is a professor of brain simulation at the Charité University Medicine in Berlin, but she's also the coordinator of the TEF Health project. So Petra, over to you.
Thank you very much, Nick. Is my slide visible?
Let me just stop sharing myself.
I just shared my slide. Is it visible?
It is, yes.
Okay, very good. Hello, everyone. It's a pleasure to present in this webinar the testing and experimentation facility for health, AI, and robotics. And the TEFs in general are defined in the EU AI Act. There you will find there the explanation what testing and experimentation facilities are supposed to provide. They provide scientific and technical support for companies and also for notified bodies. Here in the middle, you see the AI life cycle. You see the different phases of innovation development, and you can also see the different tracks that need to mature during this process: technology, regulatory, market and business, and clinical validation. And TEF Health supports companies, in particular with the validation and technical testing, with clinical and real-world evaluations, and with regulatory compliance and market access. And here a particular focus is on the regulatory compliance. So we have a multitude of services that already are actually helpful in earlier stages. If you want to translate this in technology readiness level, scale, then very early on, actually, AI Act readiness needs to be considered. And this is where TEF Health can support companies. TEF Health is a large consortium funded initially for 5 years by the European Commission and the member states. We have 52 organizations, half of them private, half of them public, and they provide their services to the companies. But we are also, as has been mentioned, collaborating with other external stakeholders, for example, EUCAIM, the European Digital Innovation Hubs, and offer the website, the matchmaking platform that we have developed also to these external services. So if a company is interested in getting support of TEF Health and validating and testing their products and achieving regulatory compliance, then they find already a lot of information, even without an account. But if they then really are interested to take a service, they create an account. They can select amongst the multitude of different services that are richly annotated and available in our service catalog, which can be already accessed without an account. So if you are just interested, you can go there and you will find a lot of information, including prices. But we also have open calls to provide the services not at their full market price, but with subsidized prices or even for free. And the applications for such free or subsidized services is also managed via this matchmaking platform. And once these steps have been passed, then the actual matchmaking takes place, and this is supported by the TEF Health front office, real humans who then actually negotiate and build a bridge between the service providers and the companies to see which of the services, which of the health data sources provides the needed resources to validate and test a very specific AI product. And so here I give you a couple of examples, practical examples, how this looks like. You will find success stories and use cases also on the CoordinaTEF website. So one of the companies that we supported is Sonovum. They built devices to measure non-invasively pressure in the brain, in the head. And they require a lot to become certified, CE certified. First of all, they need data to build their AI model, which they can get through the TEF Health. They need to understand the workflows in the clinics. They need to go through simulated testing before they then actually go through real clinical testing. And all these different facilities and services are provided by different stakeholders in our consortium and can be obtained via the single entry point very conveniently, our web address tefhealth.eu. And very often the different services come from different member states. And this is actually the big benefit of TEF Health, that the companies from different member states can benefit from services coming from all over Europe. Yeah, so the boundaries do not matter here between the member states. And with this, I would like to thank you for your attention, and I look forward to the panel discussion.
Thank you, Petra. That was really interesting, particularly this important step before clinical testing, and the fact that these are available to people from across Europe, which I suppose is one of the foundations of all of the funding that the Commission provides. So that's really interesting, Petra. Thank you very much. I'll turn to Sebastian now. Sebastian is from the KTH Royal Institute of Technology, where he's a full professor in healthcare logistics. But he, as Jaco mentioned, he's also the chair of the working group for the European Digital Innovation Hubs, and is part of a digital innovation hub himself. So Sebastian, over to you.
Thank you very much. I'm in Sweden, so this means our holidays already started, and we'll be back when you are on holidays. So if you see the child walking by, that's the reason. I have the honor of, together with Jaco, coordinating this working group on digital health within the EDI network. To a certain extent, I'm sometimes jealous of Petra because she can present something that is very coherent and has a grant agreement behind it, which is great and clear, and then she can present fantastic services. And here I am trying to represent all kinds of different EDIs who all have their separate grant agreements. And this is a very essential element because the strength is in the fact that it is not top-down coordinated. The EDIs, most likely I don't need to explain what the EDIs are, but for those of you who are a little bit new, we provide services in all kinds of areas, different application areas, and well, now in the second wave of the EDIs, it is all geared towards AI. What we observed in the digital health, the EDIs that worked with digital health, is AI was already there. So that was not a big change for us. However, you see that the strength of the EDIs is that we actually all provide something for our own regions. I represent Health Data Sweden. Well, the name Health Data and Sweden, that's exactly what it is. Which means that we try to help SMEs and public sector in the Swedish context, which is very different from, for instance, the Portuguese context, which we'll hear more about from Priscilla later. Therefore, you can't say that all the EDIs are the same. What we try to do is to connect to both the healthcare service providers and the SMEs in a way that works locally, and that's difficult. I would like to show you just two small slides, which I believe, now it should work if I start from here. This is just the example from my own EDI, but what you see is that this follows the EU setup. All of the EDIs provide some form of network and ecosystem services, some form of business development and financing service, some form of skills and training, and some form of test methods and validation. And obviously, and this is the way we try to talk about it here in Sweden, we should not think about like what does TEF Health offer and what do the EDIs offer. We should think about what does a company need. And this is a figure we made for an internal event here in Sweden, where we try to present jointly what can we offer to you. What you then see once you start diving into this is that obviously TEF Health has very clear services, mostly focused around testing, setting up testing, etc. But there's an amount of work before that, and there's an amount of work after that. And that is a life cycle which goes round and round. This is not just once that you need to do this for digital technologies. You need to do this multiple times. And this is one of the things that we also tried to discuss at the EDI Summit last June with the EDIs that were there. How can we provide seamless services, including TEF Health and maybe later on even the AI factories to SMEs as well as public sector, but it's particularly SMEs where you can do this easily in this EU ecosystem. With that being said, I think I stop here also for time reasons and give something back. But this is what we do. And well, I try to coordinate and facilitate this a little bit.
Thank you very much, Sebastian. So yeah, you're really highlighting the importance of local realities, which do differ across Europe, which makes things more interesting, I suppose. But also these seamless access to services, which is something which I think is a priority for everyone involved. So with this, I'll turn to Priscilla. We've mentioned the Portuguese context. So Priscilla, you are the project manager at the Health Cluster Portugal, and I think you can tell us a bit more about the work that you're doing there. I know we'll have a question later about the Hospital Innovation Challenge, but if you can, give an introduction to your work, that would be great. Thank you.
Thank you, Nick. I will share my screen here. Let me see. I think you can see it. All right. Okay.
Yeah, you can see it.
So I will give a brief overview about Hospital Innovation Challenge. Hospital Innovation Challenge had support of TEF Health and DigiHealth PT. DigiHealth PT is a DIH project. And it have been organizing by Health Cluster Portugal and IPN, Instituto Pedro Nunes. Thiago's here representing IPN. So it's a very brief presentation. Let me see if I can. Okay. So the idea of Hospital Innovation Challenge come from the TEF Health mission that is bring together hospitals and SMEs. We understand the hospitals, they have a lot challenge, administrative, clinical challenge. But on the other hand, you have a lot SMEs developing AI, robotic solutions, innovative solutions. So our aim here is put them put together. And for these, we combine two projects, the TEF Health. So we invited all hospitals from TEF Health, and the DigiHealth PT bring SME ecosystems and their services. So let me see. Okay, how does this initiative work? You have here a workflow of our first edition. So we invited all hospitals to identify challenges. Then TEF Health and DigiHealth team, we organize a call. Companies submit proposals to address this challenge, And the hospitals, in the first edition, the hospitals, they select the most innovative solutions, reading this proposal. So after that, the hospital selected the 60 most innovative solutions to showcase that at Innovation Health Together conference, a conference organized by Health Cluster Portugal here in Portugal. So the 3 most innovative solutions had support services and a network receive the DigiHealth PT support services and network from TEF Health. Of course, this first edition was successful. The SMEs were very happy to be there. We have a lot positive feedback, but I will show you only our numbers. We had in the first edition 5 hospitals, 5 TEF Health hospitals involved. They identify 7 challenges. We had 23 SMEs or startups applications from 10 different countries, and the hospital select the 6 most important, the 6 most innovative, and of course the most important or that responded better the challenge receive awards. Here we have a great feedback, as I said before. So, and I will show you how we change a little bit this workflow for the second edition. But I would like to show you that the impact was a very positive impact. 3 SMEs, the 3 awarded SMEs now are developing studies in the TEF Health framework. One of them initiate a collaboration with a hospital outside the TEF Health. So it was a very interesting initiative for these SMEs and the hospitals as well. As I said before, for the second edition, we received a lot of feedback, and I will show you what changed a little. Some points changed a little bit. The first feedback from hospitals was that could be interesting to have an online first evaluation. So they thought that when the companies are at Innovation Health Together conference, sometimes the solution don't address so well their challenge. So they would like to know more about these solutions before the conference. So we decided to make an online first evaluation. So I think they can ask and give feedback for companies, and it could be more interesting. After that, we received a feedback that companies didn't have support after that. So we decided that the companies, SME, that were not selected for this online first evaluation, they will receive ED or DigiHealth PT services. It's like a diagnostic. So DigiHealth will support these companies, try to developing and improving their solution from the hospital's feedback. And the last feedback that I think it's very useful for us was about the jury. The SMEs and startups gave us the feedback that we need to have external jury, decision makers there. And now in the second edition, we invited them. So we invited investors, we invite health professionals. For example, Fundação Champalimau, it's a very important institution here in Portugal, and public entities like SPMEs here in Portugal. So we have this external jury now. And I'm just to give preliminary numbers about our initiative this year. Now we have 9 hospitals involved. We decided to open this call for all Portuguese hospitals, public and private as well. So we will have TEF Health hospitals and no TEF Health hospitals. These hospitals identify 17 talents, so it's a lot. And we received 18 applications. We closed the call. We closed this application last month, and now you have to evaluate them. So we received these 18 applications from 6 different countries: Brazil, Germany, Finland, Portugal, Slovakia, Spain, and UK. And now you have to decide the 6 most innovative and the 3 that will be awarded. And finally, I'd like to show, if you want to need more information, you can see all information in our website. You can go to Agenda, Initiative for Startups here, and to have more information about Hospital Innovation Challenge, to know more the challenge, to know more the guidelines. So it could be interesting. And finally, we have here a quote from Carlos Souza. He is the CEO of Opvans. Opvans was the first place in the Hospital Innovation Challenge first edition. And he said the Hospital Innovation Challenge gave us something no other program had offered before: the opportunity to engage with leading European hospitals, present our solution to high-level jury, and compete on equal terms with innovative companies from across Europe. So it's just to show you how this initiative is important. And I think that's it. Thank you so much. If you have any question, I have my mail here and you can ask. Thank you. Thank you, Nick.
Thank you, Priscilla. That's good. That's great. You can see gradual scaling up, I suppose, of access to this, and you can see the central role of the testing experimentation facilities. So with this, I'll go to Tiago. So Tiago's a project manager and clinical research assistant at the Instituto Pedro Nunes. And importantly, he played an important role in helping EXO research to enhance their TRL level, thanks to the testing experimentation facility. So Tiago, over to you.
Thank you, Nick. So you can see my slide, right?
Yeah.
Yes.
Okay, so good morning, everyone. So I'm here to share with you a concrete example of how IPN Health Proof, through the TEFL project, supported the development of a new digital health solution. So first, a quick word of who we are. So Instituto Pedro Nunes, IPN, was founded in 1991 by the University of Coimbra, and today is a network of 46 associates across academia, R&D, public institutions, and industry. IPN is a private non-profit organization dedicated to promoting innovation and technology transfer by bridging the gap between the scientific and technological communities and the business sector. And IPN Health Proof is a part of this ecosystem. It's our dedicated area for digital health innovation, connecting the technical, clinical, and regulatory expertise under one roof. So why does this matter? Because innovation often fails without validation. A brilliant algorithm or a device means nothing if they don't demonstrate the safety, performance, and regulatory compliance. And that's the gap we try to close. We offer a single point of contact from concept all the way to the regulatory approval, real-world testing environment, aligned with regulatory requirements, and integrated expertise across technical, clinical, and regulatory domains. In specific, we support startups and SMEs across the full life cycle of a digital health solution in 3 stages: the design and development, the preclinical and clinical testing, and the medical device regulatory support. It's also important to mention that we work with companies both by specialized services and also innovative projects. So there's more than one way to engage with us, depending on where you are in your journey. So now let's look what this looks in practice with the Cardio AI, the solution from EXO Research. So Cardio AI is a cloud-based analytical platform for high-level cardiac analysis and reporting, and they built this ECG for technicians and cardiologists. It's classified as a standalone medical device software, and by the time they came to us, Cardio AI was already very high level on the technology and clinical maturity. The solution was deployed in real clinical environments and used in validation activities across multiple international partners. So this wasn't an early stage prototype, it was an advanced solution facing a common struggle that most of digital solutions had. And the challenge that they were facing was that both the MDR and the ISO 13485 gaps remained before the market introduction. So their notified body had raised observations that required a structured, well-documented response, and also non-conformities were identified during the quality management system audits. In short, they were navigating the difficulty from transition from an advanced development to a market-ready solution. And this is exactly where IPN stepped in. Through the TEFs project, we reviewed, updated their technical documentation for regulatory submission, supported the resolution of their audit findings and quality management system non-conformities, providing them guidance in the MDR compliance and also the ISO 13485. And the result speaks for itself. CardioAI is now a Class 2A medical device with the CE marking under the MDR, also as a quality management system certified by the ISO 13485. And TEFs help here to close this gap between the technological advancement and the regulatory readiness, giving CardioAI specialized expertise and tailored services, to advance trustworthy AI for clinical use. So if you are working in digital health with digital health solutions and facing similar regulatory or clinical validation challenges, we love to talk, and thank you very much for your attention.
Thank you, Tiago. This is really, really practical and really interesting. It's a very nice example of how important the whole network is and how an SME can really step up towards market deployment. So I'd like to invite Ignacio Blanca now to join. Now he's part of the Cancer Image Initiative, the New Cancer Image Initiative, and he's also a professor at the Computer System Department at the University Polytechnic in Valencia. So Ignacio, from your perspective with this huge initiative, could you give us an overview of that, please?
Yeah, thank you very much for inviting me to this event. I will try to focus. I'm the technical coordinator of the European Cancer Imaging Infrastructure, which is an initiative that is being built through a project that is called UK, that is trying to gather existing data from different research projects and clinical trials and facilitate the collection of additional data and make them available in this infrastructure for different reuse according to the HDS regulation, and also providing, keeping the advantages of the specific legal ground in which the data was collected. So we act as a federated infrastructure. We have a central hub in which we run all these services for federation, in which we have a central catalog of all the collections that are available, a federated search mechanism in order to collect, to understand the number of cases that fulfill some specific inclusion criteria or decided features from the users. Access negotiation system, because the data is not openly available, is also accessible on the request and motivated by a project application that can be industry level or research level in both cases, and also supported by some legal documentations for the entitling the access and the processing of the data. So we have a network of providers that are running their own nodes connected to this system and provide the data through data sharing agreements and also computing resources. And we have other providers that do not host those computing resources and transfer either permanently or temporarily the data to reference nodes that we have with secure processing environments. So in this system, the data user journey is quite aligned to the European health data space. So there's an initial dashboard in which the users have access to the different tools that are in the infrastructure, in which they can discover the data through the catalog and our federated search, identify which are the key data sets that they would like to use, and then request access to them through the negotiator tool. All these tools have been developed by different groups in the consortium, like Erasmus Medical Center, the BBMRI, DKFZ, UPV, etc. So once the access to the data set has been granted, the permissions are adjusted, and then they become available in the users library in the dashboard. And they can, depending on where the data set is available, they can access in situ in a secure processing environment without the ability of taking out the data, but with the possibility of exploring it and running on advanced computing resources, or using federated processing for running the processing along different nodes in cases that no ability of accessing the data or visualizing the data is provided. With this environment, we also have developed a secure processing environment software as a service that can be quickly deployed on top of other infrastructure. We are prototyping also a collaboration with Euro HPC with the AI Boost project, deploying this in a channel composition. And it's also a tool that can be, a stack that can be used to deploy these federated nodes that are available there. The role of EUCAIM is not a single project. I mean, the idea of EUCAIM is becoming a European Digital Infrastructure Consortium. We have created already the interest group, we have the working group, and we already have the commitment of Spain for hosting the EDIC as the coordination country, with the funding already secure for their implementation. So we expect that during 2027 we will be able to reach the minimum number of countries, and even more, because we have 18 countries interested so far, half of them as observers, half of them in the process of becoming of being able to apply as members. And this is the idea. Once that we have an EDIC, we will request we will apply to become an authorized participant in the context of the European Health Data Space to be able to support the whole thing. With respect to TEF Health, we are very, deeply interested on setting collaborations, and actually we have already agreed on preparing a joint challenge that will be certainly announced during September. We are now in the conversations that will try to provide the resources and services, and especially the data that are available in UK, with all the capacity, experience, and know-how, or especially on the part of the validation and regulation, that will really help UK on having additional use cases, and we will try to contribute with our data and resource and services to the community. And very quick, that was all from my side.
Thank you very much, Ignazio. That's great. So what we'll do now is we'll go to some questions, okay, for the panelists. I think what we should do is possibly stay on the track. So the different presentations really showed the importance and what is actually happening in terms of collaboration between initiatives, and also in terms of facilitating this pathway to small companies. There's a few questions in the chat, so if the panelists want to have a look at them as well, you can maybe multitask and see if you can answer some of those questions. But they do relate to some of the things that we've discussed in terms of when and how SMEs can access these facilities. But maybe I think the first question is for Petra on this topic. So we've seen, I think, some practical examples of the central role of the testing experimentation facility, and practical examples of how it's supported, in particular in Tiago's case, the increase of TRL for that particular company. So TEF Health obviously has a clear role. Can you are there any other practical examples that you've experienced?
Yes, yeah, I'm very happy to do that. And as mentioned, you will find a multitude of more examples on the CoordinaTEF website. There we have success stories of all 4 TEFs, and you can, of course, also filter TEF Health, and there you find now several such examples. I very shortly mentioned the example of the device that measures non-invasively and with an AI algorithm the pressure in the brain, which is for the patients a big advantage because you do not need to put a device in the brain, which reduces the risk for the patient. And there we were able, as TEF Health, to support the company such that they could increase their technology readiness level from 6 to 8. And this is very abstract. So what has been done was to demonstrate that the system works in a relevant clinical environment. And to achieve this, several types of support have been provided. So first, there was performance evidence generation under controlled clinical conditions. So we provided access to the clinical conditions, to the neurosurgery setting in order to test the device. Then based on the initial data, there was a refinement of the machine learning algorithm through the expert-supported testing. So basically the neurosurgeons were able to provide feedback that then was integrated in the algorithm to improve it. And also we supported through clarification of the regulatory pathway for this device. And on a more high level, this support of TEF Health was leading to a strengthening of investor and stakeholder confidence. And with this, we hope to have supported and accelerated the market entry, so that the real world deployment of the device in the future. What we can say now, because we cannot really predict the future, that as a consequence of the support by TEF Health, the product is now tested in a registered clinical trial.
Excellent. Okay, so another really practical example. You mentioned that you have these, what should we say, success stories or cases on your website, yeah. So people can find them. I think which is really important because obviously if you can see the practical benefit in practical examples, and that's very important. So, turn the next questions to Sebastian. So, we've heard the examples of how EDIs have complemented the facilities which the TEF Health provides. And what other unique value do the EDIs bring? Obviously, you talked about the local realities, which I think is essential. And how important is it to engage with public administrations and government on this topic?
To start with the second part of your question, in almost all of Europe, the public side is A to Z. It is everything. Because in the end, it is paid for either by an insurance system or directly out of the tax system. What we observe in multiple EDIs, not the least my own, is that we also need to prepare the market. And preparing the market needs to go in parallel with the developments and the validation of the actual technologies. Otherwise, there won't be anyone that can pick this up. And even successful examples of things that, for instance, come out of the tournament challenge that Priscilla showed will not be scaled. So one of the very, very big questions that keeps coming back is, which type of evidence do we need to generate here locally to be able to adopt something that has been successfully implemented elsewhere? What we then can do, and that is the type of more advanced services we can provide as EDIs, is setting up a full plan. How do you finance the evidence generation? What are the local requirements? Because all countries and even regions, I live in Sweden, as I said earlier, we have 21 regions, which means that we have 25 different regimes and at least 100 different interpretations of those, one for each hospital, if you're lucky. So dealing with this, balancing, let's say, the large standardized power of the European process, being able to do things once in one member state and then it should work in other member states as well. Matching that with the reality of the publicly funded healthcare systems is something where we really can provide services and do provide services as well. Like I said in the beginning, it is sometimes difficult to put a name on it because every EDI will have their own locally invented name for that particular service. And that is something that I hope we can now work on together in the forthcoming year, maybe 2 years. There should not be a wrong entry into our network because in the end, all of this is funded by the digital program, which means that we should be able to guide every request to the right place. And therefore events like this, but also other networking events between us are equally important as reaching out. We need to be able to say like, okay, let me make a phone call or an email there and there, because I believe they can help you without the grant agreement saying that I need to do this, because this should be the DNA of all of our structures.
Thanks, Sebastian. That's a very good point about the DNA of our structures, isn't it? Because some of these channels are not established, and that can often be a practical barrier. But yeah, making sure that these connections do exist, as I think everybody's kind of given these types of examples. So maybe I could turn to Priscilla on this point around the real needs of a hospital and giving access to them. So in your experience of the Portuguese context and the calls that you provided, how are you able to really make sure that the calls addressed the actual needs of the hospitals?
So, Nick, I think the hospitals, as I said before, is a relevant initiative. We have real talents, we have real solutions, and we bring together SMEs and the hospitals to a direct interaction. So I think it's the first point that it's important to respond to you. And I think this interaction, it's very important. Network, it's very important. But in the hospital innovation talent, the hospitals, they can provide feedback, better understand the solutions. So I think it's easier in this network, you understand what the solution, what's the proposal, and facilitates this access to the testing and the experimentation opportunities. Because when you have a solution and this real conversation, I think it's easier. You think a department, a specific department that in the hospital, it can be useful, the solution can be useful. So I think this part is very important. And we had a very good examples in the first edition. We had the three solutions that was awarded: the Body Bloom, Opvance, and Cardio AI. Not Cardio AI, but the Opvance and the, I forgot the name, the other, Vitruvian. They could have this contact with the hospitals and make validation in the hospital. So I think this feedback is very important, and this real conversation is very important.
Thanks, Priscilla. Yeah, I think it really sets the context if the hospitals are involved in identifying the needs for these types of actions. Tiago, you obviously have this prime example of directly engaging with an SME. And what would you say to another SME that you encountered? And are there others coming to you? And how do you, I suppose, get them involved? What types of message do you give them to help them?
Yeah, of course. So we get leads and companies that came to us from multiple channels, and of course we are trying to have this single point, this single channel that Petra already mentioned, the website, the platform that TEF Health is building, and to have all of these applications and requirements on this platform will really help us to build here and to better know the solution and how can we support the SME. If not as IPN, all other partner in our consortium can support the company. And then also the most of the leads that came to us from what Priscilla mentioned, they want to work with the hospital. They want to have their solution validated in the hospital. So it's really important from us to have this feedback and constantly open communication with the hospitals team, the project managers inside the hospitals, to give us these companies. And then we talk with them, we see what is the need that they have at the moment, if it's regulatory need, if it's a testing in real world environment, if it's other type of preclinical or validation of algorithms and so on. So we try to have a specific conversations with each company and support them for their specific need.
Thank you, Tiago. Yeah, this is, the practical examples are really important, and your role in talking to the SME obviously is vital. It's that the human touch is vital, and that type of support, or one-stop support, if you like, is very important. So, just going back to the cancer imaging. I'll post this question first to Petra, and then Ignazio, you can come in as well. But you discussed with the presentation, and also what Petra you've said. The importance of this combination between the cancer images, which is a huge initiative, and the experimentation facility. To accelerate these solutions. How can this become a model for other health domains? Because I think, so a nice presentation from you, Ignazio, and at the end you've got this agreement and collaboration points. So Petra, first, how do how could this scale up to other health domains?
Yes, so first of all, to add what has been already said, another already existing point of collaboration that is visible with UCAME and TEF Health is the provision of visibility, discoverability of the UCAME data services via TEF Health. I just put the service catalog link, which is public, in the chat. And if you are selecting external services, which are not TEF Health services, you will directly find the UCAME data services, and they can be discovered there. Why is it so important to make use of synergies and to work together? So one aspect that TEF Health has now developed with the platform is to provide a streamlined provision of services to companies in compliance with state aid. Yeah, we often hear, for example, in the AI Act, that services are to be provided for free. And the infrastructures are often co-funded or fully funded by the member states, and therefore all these service provisions to companies fall under the European state aid regulation. And this comes with regulatory requirements. So there's not just regulation for AI, but also for this type of service provision. So giving free access to data, giving free or reduced price access to secure processing environments to companies needs to be managed in a proper way. And we have established this workflow, the evaluation of applications and open calls by companies, the eligibility criteria that needs to be checked, and the service provision that needs to be reported to central member state registries where the information then is collected at the European level, and so forth and so forth. So there's a lot of bureaucracy. And with such platforms like TEF Health, it is possible to pass on the learning that we had to other providers of services, like UCAIM, for example. They provide the data access, the access to secure processing environments to companies. We had an open call that closed at the end of May with the Health Data Hub, the French Health Data Access Point, who had a very similar set of offerings as described by UK, just not focused on cancer, but in contrast on the national health data. Yeah, they also provide them compliantly via secure processing environments and so forth and so forth. The management of such provisions of services can be run, for example, via a central platform like TEF Health. And I think bridging the different consortia, the different initiatives helps to use the synergies that have been created to pass on the learning that the different stakeholders had, and to all together work more economically, which of course is important.
Thank you, Petra. Ignatius, do you have anything?
Yes, I mean, along what Petra said, which is absolutely shared by me, we have this individual contribution by individual services that are identified and can be populated in TEF Health. As we have done by the whole data platform, but also what is very important is to have the synergy on the expertise. I mean, we have expertise on how the data is organized, how the data can be harmonized and put together in a federated environment, which is a challenge, especially for reaching high number of individuals. And TEF Health has a very high level of expertise on making and running these validation cases that dealing with the regulation, and also helping us on, because we are very focused on the data use regulation with respect to health, and there are additional scenarios with the regulation that the SMEs have to follow in order to make the products available, which will be very important for us. If we can facilitate or provide environment in which, or provide the way of collecting the data or the way of making the agreements with the expertise of TEF Health in order to speed up this process, I think that will be a win-win situation, which we can be, we can also set up a way of working that can be expanded by in other communities like cardio, that is really now being organized in a similar way, or other imaging-related communities, which are very intensive competing in terms of resources and also in the terms of the potential exploitation of AI models.
Maybe if I may very quickly add, so thank you very much, I fully agree. I think this actually bridges nicely back to what Jaco said in the beginning. There are two different units, the health unit and the unit that supports SMEs. And these are also different expertises that need to come together to then create impact. And this is happening here. Yeah.
Wonderful. Thank you. Thank you very much. Very nice. So, we've heard from each of you on the different perspectives. We've heard about the importance of discoverability. I think this is very, very important. Linking the services which are provided need to be discovered. The importance of respecting and understanding local realities as well, in terms of different networks of SMEs, and the difference between the company in Sweden and the company in Portugal. because obviously there are differences, and there's also differences in different types of testing as well. And we've seen the importance of for an SME to be able to test and increase their TRL level in a very practical way, which will be beneficial for them. And then, of course, the overarching importance of government and the funding, which often comes from government and from insurance as well. But the final question, I think we originally said 1 minute, but I'll try to reduce it to 10 seconds if you can, is how you see success. Okay, so looking ahead, how would you define success for the different instruments that you're part of? And we were going to say, what tips would you give SMEs? But I don't know if you have enough time to cover both points in 10 seconds. So, how would you define success for looking ahead to the future for your various initiatives? I will go first to Petra.
Yeah, thank you, Nick. So I think it's absolutely essential to have AI preparedness by design. So product preparation for AI regulation needs to start at the very beginning. As we say, GDPR by design and by default, the same needs to be the case for AI products.
Wonderful. Thank you, Petra. Let's go to Sebastian.
For me, it would be that companies that develop AI solutions think that the EU is a fertile place to test and deploy their stuff and not needing to go to the US or another market first before coming back. If we get that, then we succeeded.
Very good. Yeah, very good point. Let's keep them in Europe as much as possible. Priscilla?
Well, in the hospital innovation challenge I will focus on, I think you need more hospitals involved and give more responsibility for them and more validation, of course.
Okay, wonderful. Yeah, the hospitals are key, really, aren't they? And then Tiago.
Yeah, I think I want to touch it on SME tips since I'm more direct contact with them. My tip to them is to, when they contact us, to come with a real gap. Not a wish list. The projects that usually go fastest and the ones that we can give more value are the ones when the company already knows what they need. And if they don't know, they need to define the regulatory roadmap to have the CE marking. So start by that, by the one block by block, and not thinking the whole process.
Thank you, Thierry. And it's very important that they were able to do this as well, because they're important planning steps. And finally, Ignazio.
Yeah, I mean, aligned with the comments of my colleagues, but I think that our key challenge is to lower the complexity and the cost in accessing the data by the SMEs, and therefore, in order to achieve what my colleagues have already said.
Absolutely, yeah. So lowering complexity, increasing visibility, and yeah, AI by design. So thank you very much to the panelists. It's been a really interesting discussion, really rich with examples and really rich with solutions as well to this question of bridging between different funded activities. As Sebastian said, this should be in our DNA, which is a very important message. So what we'd like to do now is we'll shift to the interactive workshop. We really would love as many people to stay with us as possible. The workshop's targeting EU-funded projects. So in particular, projects funded under the Digital Europe programme. These are some of the projects which we know have registered for this part. If you don't see yourself here, just join anyway, it's fine. I'll hand over to my colleague, Gabriele, who will be leading this part. It's going to be interactive, so we don't really want you to be looking at other stuff. We would like you to be adding things to the mural table, which Gabriele has designed. The objective is to find collaboration points to build on the discussion that we've just had and see if we can, as Jaco said in his opening message, build some of these bridges between the projects so that they go beyond the boundaries of their grant agreements. So Thank you very much to all of the panelists, and really thank you everybody who's attended this part. So we'll switch over to the workshop. Please stay on. Okay.